So what if I told you your hypothyroid problem you're dealing with is never just a thyroid problem, ever?
I would tell you to go back to school because that doesn't make sense. Regardless, show us your scams.
What we discovered was I was the first practitioner to actually assess her adrenals completely. You need to make sure you're getting your adrenals, your DHEA, your cortisol, complete check, because this patient had some of the lowest levels I've seen on her urine Dutch test. Not only that, she had positive autoimmune thyroid antibody markers. These two things we just went over right now are the biggest culprits for why TSH goes up and why we have hypothyroidism in the first place.
This is a double whammy. Not only is there no indication for adrenal testing for normal hypothyroid patients, no one will say get a urine Dutch test. Those are not accurate by any means. They'll also charge you $400 for it, not including the repeat visit to interpret them for you. This one's just funny to me. They say, oh look, their antibodies are high, that's why they have hypothyroidism. Yeah, more than 85% of hypothyroidism is because of an autoimmune condition. That's not news. Now here's the thing, once you start someone on thyroid medication, it's useful to test this marker again to make sure it's back in the normal range, which for a non-geriatric population is somewhere between 0.5 and 5. And I know the font is small, but right here it says 22. The answer is just increase their dose. Obviously, there's some nuance. Maybe they didn't get the refill. Maybe they weren't taking it. Maybe they were taking it with other medications. Maybe they just fell out of contact with their old doctor. It doesn't matter. The point is to have that conversation regarding the medication. That's it. All of those extra tests are scams and a way to steal your money. Don't get scammed. Take back your health.